Participants of BTXCARES Talks are fully vaccinated, wear face masks, and follow social distancing guidelines. During these segments, face masks are removed to provide clear messaging to the public. Our production crew continues to wear face masks and maintain social distancing during the filming of these productions.
Hello, Brownsville. I'm Michelle Jones, the city's epidemiologist, and I'd like to welcome you to BTXCARES Talks. And this is the space where we talk about important topics that affect our community. For today's segment, we have with us Mr. Art Garza, the CEO of Valley Regional Medical Center. So thank you for joining us on BTXCARES Talks.
It's a pleasure to be here, Michelle. Thank you very much for the invitation. I'm looking forward to this.
Oh, I know. It's super, super exciting. So one thing, just to start off with, do you mind telling us a little bit about yourself and your hospital? Because some people might not be familiar with who you are and what your hospital does.
Absolutely. I'd be glad to. Again, my name is Art Garza. I'm a native of Brownsville, Texas. Born and raised here, so proud of how the city has developed and all the rich traditions and legacies that we have. Valley Regional has been serving our community for almost 50 years. In two different locations. Originally started off out by the port on Ted Hunt Road. I'm sure that many of our community members remember that. Most recently, as of the past 24 years or so, we've been on Alton Glory Boulevard. So what many people don't know is that Valley Regional is actually part of the largest healthcare system in the United States, the Hospital Corporation of America.
Oh, that's great.
Yeah, so when you go, when our friends and families travel to communities like Houston or Austin, well, you'll see some of our hospitals in those areas. Denver, California, Florida, you name it. There's almost 190 hospitals that belong to our system.
Oh, that is great. So that way you have a lot of collaboration if you need it, or that extra work, especially during COVID, because, well, we've learned that those partnerships.
Well, you know, that's absolutely true. When we started experiencing our surge locally, many of our sister hospitals had already experienced their surge. So we had the benefit of learning from them. And we had the benefit of sharing medical staff and even staff like frontline nurses and respiratory therapists and a variety of other specialties that came to us with a lot of already understanding, knowledge, helped our teams react quicker to what we were experiencing. And so it made us a little bit more capable, ready to manage faster.
Oh, that is so great. And since we are talking about managing COVID, we have the new Delta variant out. And one of the questions that we kind of ask is, like, are there any concerns that you're seeing as a CEO of a hospital in the area with the Delta variant and the increase in cases?
Well, I think the concern is the same regardless whether we're talking about Delta variant or not. At the end of the day, we want our community to be healthy and strong. And at the end of the day, the things that we've heard of time and time again, such as social distancing and facial coverings, even getting vaccination, all of those things make a big difference in reducing transmission across our community. So I can't tell you that there's any significant concern that is brand new regarding to the Delta variant. I would say that the concern is the same. It's still the same virus, maybe just slightly different. And the way we know we can make a big impact is by doing those things that I mentioned just a few seconds ago.
And I think that's so very important because we've already been through some of the spikes, so we've got that game plan ready and ready to go at a moment's notice if we do have those increases or a new variant emerges. One thing that we don't talk about often when we talk about COVID-19 is how COVID-19 and the increase in hospitalizations, how that might affect other aspects of a hospital or healthcare facility when it comes to their care. So one thing we like to kind of open up a dialogue about is when you're not vaccinated and you're ending up in the hospital, what other effects does that have that are non-COVID related, let's say with like chronic illness or individuals who might be involved in a car wreck or?
Right. That's a great question. I don't think that because we're experiencing increased volumes of COVID across the country, that things or events like strokes and heart attacks stop, right?
Yeah.
I mean, they continue to happen. The most important message I can share with our community is to not defer care.
Yeah.
If you feel that you have symptoms of anything, you should go see your doctor and not delay care. Because then it makes it more challenging for our providers to really understand what's going on, diagnose and treat, and the last thing that you want to do is delay that. You just don't know how that delay in care could snowball into bigger issues. And that's at the end of the day, that's the biggest message I would have to share regarding this.
Okay, but that's very important because I know some people are afraid to go to the hospitals or to seek that medical care because of COVID, but then you end up needing emergency care, and so I appreciate you bringing that to our attention. One thing also that we like to talk about is the vaccines, because that's a new, the previous spikes that we saw when we got hit, we didn't have a vaccine, so we had to heavily rely on those non-pharmaceutical intervention measures like the wearing masks, proper hand sanitation, and socially distancing. So now that the vaccine is on the scene, do you have any thoughts for our people when it comes to that?
Sure. Vaccines are readily available. When they first became available in the marketplace, I think we all heard of stories how people in our community and across the country were waiting for hours to get the vaccine. That's not the case anymore. There's really not a reason why you can't get the vaccine if you want to take the vaccine. Regardless whether I believe whether you should take the vaccine or not, it seems across the country those that are vaccinated are less likely to get COVID. And if they do get COVID, then the symptoms are not as strong. And so there is an opportunity there to reduce the chances of hospitalization through the vaccine. So there's a lot of value to getting the vaccine, but on top of the vaccine, as we've discussed and everyone has heard so many times, the masks work, the distancing works, making sure that you're practicing safe behaviors such as washing your hands, all those things work. And you throw one more layer of protection, which would be the vaccine, I think you have a better chance of preventing infection.
Yeah, and I'm sure the people at the hospital really appreciate it because they've gone through this marathon of hospitalizations and ICUs, so we're kind of helping you guys out also because I know your staff has to be exhausted and your nurses and your doctors. And
that's a good point. I cannot begin to express the gratitude that I have for our medical staff, our providers in the community, the nurse practitioners, PAs, the doctors, all of them are doing just a humongous job, great job of taking care of our community. But so too are our nurses and our respiratory therapists and everyone along that continuum of supporting patient care.
Yeah.
And they come in places that maybe aren't as obvious, such as the folks that are supporting food services and nutrition, or the folks that are supporting the cleanliness of the hospital. All of those people have a huge role in making sure that when a patient does come to our hospital, they're well supported. So they should be recognized as well.
Oh, thank you. I think that's so great because sometimes we kind of overlook how important it is for our sanitation individuals because they're sanitizing all those rooms and making sure that there isn't any spread. So I think that's really great. Thank you.
You know, the one other group that is really important to recognize because they also play such an important role in overall care of our community are the EMS and firefighter teams across the city. I know how busy they are. Our hospital keeps in close contact with Brownsville EMS and fire, and those teams are just second to none. They put themselves in harm's way every single day to give of themselves to our community, to support our community, and we just cannot forget them because they are a really important part of this equation.
So that's really important information that you've given us, but we might have missed something, or you might feel that there's something really important that we need to get out to the population. So before we close out, Is there anything else you'd like to say and bring to our attention?
Absolutely. I always have something to say. I would be remiss if we just didn't stop to recognize how great our 2 hospitals are in our city. You know, we have the strength of really big companies that support healthcare across this entire nation. And locally in Brownsville, both Valley Baptist teams and Valley Regional teams have just done a tremendous job, again, giving of themselves day in and day out. And there's no doubt that we want to get past this. There's no doubt that we want to go back to whatever normalcy is. But today we're helping our community get through this virus impact. And we'll continue to do that tomorrow and the day after and the day after that. We are healthcare teams that live in our community. We support our community. Our friends, families, loved ones are in this community, and it's special to us. It's quite an honor for us to be able to care for our community. So I want to make sure that we recognize both hospitals, and of course, particularly my team, the Valley Regional team. It's an amazing group, 750 strong, over 400 doctors on our medical staff, countless providers, every single day fighting this fight. I want to thank you, and I want you to know that I appreciate everything you do to keep our community strong. Thank you. Thank you for giving of yourself every single day. I really appreciate it, and I know our community appreciates it as well.
See, that's really great. And I love that camaraderie among our hospital staff and our city staff, just working together to create the safe environment. So thank you.
Michelle, I think there's value in saying that together we're stronger, together we're better. No one entity can go at this alone. It's just too big. And the price is too high to pay if we're not able to respond in the best way possible at the moment. I think together we're able to respond in the best way possible for our community.
That is so great. Thank you so much. As always, I want to thank you for coming down. I also want to make sure I thank all of the staff, the dedicated staff at everybody's hospital, yours, and all of those frontline workers that are out there. So we appreciate that immensely. In addition, we hope that the community found this information beneficial, and if you still need more information or have questions, you can always visit the cdc.gov website, or you can call our COVID-19 hotline, and that's at 956-394-0012. And if you'd like to see more segments like these, remember you can always go to the city's official YouTube channel and check out those additional segments. For BTXCARES Talks, I'm Michelle Jones, the city's epidemiologist, and I'm here with Art Garza, the CEO of Valley Regional Medical, and we're reminding you to stay safe and to stay sanitized.